Hi, welcome to Dr. Chaudhary's Homeopathy. This is Dr. Venkat Chaudhary. Today I would like to share a nice skin case, that is viral warts. This case shows the effectiveness and greatness of homeopathy, how the homeopathy deals with the surgical cases and cautery without cautery. The warts has gone up in this case. This case is for the students and growing homeopaths and enthusiasts. Watch the video until it is over. Before that, subscribe my YouTube channel and spread homeopathy. Thank you.
ತಪ್ಪಗಿದ್ದಿದ್ವೆಲ್ಲ ಸಾಫ್ ಆಗ್ಬಿಟ್ಟು
ಆಗ್ತಾ ಇದ್ದಾವೆ ಮತ್ತೆ ಟೆನ್ಷನ್ ಆಗೇ ಇರ್ತದೆ.
ಕೂದಲು ಮೇಲೆಗೆ ಹೋಗಪ್ಪ ಮೇಲೆಗೆ
ಚೆಕ್ಕಿದ್ದು ಸರ್ ಇಲ್ಲಿ ಎಲ್ಲ ಕಂಪ್ಲೀಟ್ ಸಾಫ್ ಆಗಿದೆ ಸರ್. ಇಲ್ಲ ಸರ್ ಅವ್ರು ನೀವೇ ಚೆಕ್ ಮಾಡ್ತಾರೆ.
Coming to the case, the boy age is 8 years, residing in Ballari, has consulted me in my clinic along with his father for his skin complaints. Chief complaints are skin eruptions were raised just above the skin surface. Why I used just here? Almost all it is the level of skin only. After watching thoroughly the eruptions, I have given here the eruptions description. These are all my observations only. Warty eruptions just raised a little bit from the surface. We can say those are flat eruptions. The diagnosis is flat warts. Subject to description, when I asked the patient what were the complaints, he narrated like this: eruptions started to appear over the body since 2.5 years of time. Since the beginning of eruption it has been giving itching only. Gradually it became flat bump over the hands and extending to both hands and face at forehead place also. These warts spreaded all over the both hands and forehead also. You can see the eruptions in the video. Somewhat the boy and his parents considered them as non-dangerous things or non-dangerous eruptions. As they go on its own, they felt that as they go on its own, but they had grown in size and started to appear at other places also. Whenever he scratches the eruptions, that is warts, a thin layer comes out from the surface of the wart. The layer is very thin, like a psoriatic desquamation. There was no influence over the mind from these skin diseases. He has no worry and anxiety about all his skin elements. So that was the case. So I took my objective observation under consideration. So I analyzed the case like this. From the case, I got only objective symptoms, as you know, and as subjective sensation, itching only, he expressed. Essentially, no mental symptoms was, but I considered a symptom as a characteristic that a thin layer is discriminating on scratching as mimic as psoriatic scales, which is very thin layer could consider their thickness scarcely. You can't you can't measure the thickness, very fine thinness, except a little bit white color only. So coming to the rubrics which I selected for this case, I decided to go to find out the local characteristic symptom of the wart, to find it in the skin chapter under the warts rubric. The rubric is warts with a thin epidermis. This rubric represented in the synthesis repertory as well as complete repertory, but in complete repertory, warts condylomata with a thin epidermis. The above said both repertory showed the same medicine, which has characteristic feature of thin epidermis over the surface of the eruption, that is wart, which is easily detached on scratching. So given remedy is acidum nitricum in 30 potency. So follow up. The next 1 month time, all the warty eruptions has gone as shown in the videos. You can observe the videos before and after. So this case shows the effectiveness, the affinity of the homeopathy over the skin elements. You can treat the skin elements very effectively with the homeopathic remedies. You can avoid the surgical intervention or cauterization in case of warts. Surely you can develop confidence after treating the cases. This case shows usually the homeopathic has such a affinity in the viral infections and skin manifestations. Thank you for watching. Subscribe my YouTube channel.